Today we're going to talk about healthcare compliance for your private practice. First thing you need to understand and accept that as a healthcare professional, you have obligations to the general public, to the patients in your practice, and to the colleagues within your profession. By these obligations, you are to uphold the highest standards of professionalism and stay within the scope and boundaries that are set forth in your practice. When we talk about compliance, there are a lot of different pieces that have to fall into place in order for a private practice to be in true compliance. Today we're going to talk about some of those pieces. In Compliance 101, Debbie Trocas states that the lion's share of fraud and abuse is attributed to documentation and billing irregularities. Basically what she's saying there is that most of the things that are seen as fraud and abuse in the government investigations is nothing more than just irregularities or errors by the doctor in their documentation or their billing and coding process, or a combination of all of those. It behooves us as professionals to make sure that we do everything we can to uphold the standards of the practice guidelines and to make sure that every document we submit for compensation is accurate and fully documented according to the guidelines based on the scope of practice in the states in which we practice. 5 of the most common errors that we see in poor documentation is that signatures or identification of the patient or doctor are not clear. Diagnostic tests ordered aren't supported by the history examinations. There's not enough data to truly understand or follow up on the treatment plan. The daily assessment notes are very sparse, many times only containing a diagnosis without any documentation to show how you as a professional reached that diagnosis for that daily encounter. Or you're billing insurance carriers and expecting to be compensated or reimbursed without giving the proper documentation. When we talk about medically necessary versus clinically appropriate, you must understand that there are certain criteria that have to be followed. First, we'll look at the clinically appropriate, also commonly known as supportive or maintenance care, may also be deemed as palliative care. There's nothing wrong with clinically appropriate care, and as a chiropractor, it's the objective that we want all our patients to reach, but it's not a level of care that we can expect a third-party carrier to pay reimbursement on. Clinically appropriate patients are what we typically think of as our wellness or health care or healthy lifestyle patients. When we talk about medically necessary, these are patients who have acute problems, or we have an active care treatment plan where we can provide a measurable and functional improvement, or it may be chronic care where we still have an expected functional outcome. Then medically necessary is often defined by the carrier's medical policy. So when you set up your practice and you start enrolling with third-party carriers, then you want to find out from them what is their guidelines or their requirements to meet the medical necessary documentation standard. In order to have a compliant office, you must first have policies. Once you establish the policies, then the policies will help you determine or define what your process is. Once you have the policies in place and the processes through which you will fulfill those policies, then you need to develop a way of auditing or monitoring the process to see if the processes are in line with the policies. Once you have those 3 pieces in place, then you can say you have compliance within your practice. When we talk about compliance, there are 2 different types of compliance you have to follow. One is the OIG compliance. Okay, the OIG compliance is the Office of Inspector General, and this really relates to the fraud and abuse process, or making sure that things that the government is paying for are being adequately documented and is what the patient truly needs. When we talk about HIPAA compliance, now we're talking more in terms of protecting the patient's rights, making sure that the patient's record is protected, that we have encryption on our software, that patients are protected from identity theft, but also that the patient knows what their rights are under the HIPAA as far as accessing their records and who they can and cannot release their records to, or who we can and cannot discuss their case with, and those type things. So the OIG compliance you want to think of in terms of the money side of the practice. The HIPAA compliance is more of the patient side of the practice. It's a balancing act between providing quality patient care and making sure that you're compliant. You should go into your practice with the thought that patient care is your primary concern, and take care of the pieces that you need to take care of to be compliant before you start your patient care. Now, that is not meant to say that you have to get all your T's crossed and all your I's dotted before you ever see the first patient, but you should at least have a good step, a good measure in place towards being compliant, and make sure that you employ and utilize the resources that are out there for you to be a compliant office while at the same time you're providing patient care. We're going to look today at the 7 essentials of an effective compliance program, and these are designated by the Office of Inspector General. At the bottom of each of these slides, you'll see the web link if you want to research the full document yourself. The first thing you want to do when developing an effective compliance program is designate the officers. Now, the OIG, Office of Inspector General, states that you should have a privacy officer and a security officer at minimum designated, but it's also a good measure to have a compliance officer established. The privacy officer is the person who is responsible for making sure that all the HIPAA privacy guidelines are being followed. The security officer would be the person making sure that you are compliant with the HIPAA security measures. When we talk about the difference between privacy and security, think of privacy in terms of the actual patient record, whether it be a paper record or EHR, and how those records are maintained, who has access to those records, and what the policy and process is for releasing those records. When we talk about the security officer is the person who's responsible for making sure that the IT side, or the electronic side of the patient record, is adequately protected with firewalls, encryption software, and those type things. Then the compliance officer is the person who would be overseeing both the privacy and the security officer. In most practices, it works best if the office manager is the privacy officer and the security officer is an IT person that is contracted to just ensure that the hardware and software within the EHR programs or the processes of the patient, of the office, that include electronic data interchange of patient information are secure and protected. And then the compliance officer is just responsible for seeing that those things are carried out. And typically the compliance officer will be the owner doctor of the practice. You then want to develop your compliance and practice standards. And within those compliance and practice standards, you would state who is the privacy officer, who is the security officer, and who is the compliance officer. But some of the pieces, and this is not an all-inclusive list, but at least a starting point that you want to include in your compliance practice and standards, is a mission statement, why you're doing what you're doing, who are you serving, or who do you intend to serve. State your practice guidelines, what source you use as your practice guidelines. Include what the responsibilities of the employees are, whether it be a general responsibilities or job-specific responsibilities. For example, the person who handles the appointment book and the reception desk may have different responsibilities than the person who's responsible for billing and collecting the insurance. And then also state what your responsibilities as the employer are to both the employees and to the practice. And it would also be a good measure to include a basic outline of the HIPAA guidelines and your intention as a compliant office to follow the HIPAA guidelines. The third thing you want to do is define your training and education process. Determine and establish within your policies manual who is to be trained, how is training provided, and when is it provided. Under HIPAA, anyone who has access to the patient records, whether it be a doctor, staff, volunteers, any person in whose job, function, or activities within the practice would give them access to the patient records must be trained on HIPAA. Now, how training is provided is up to you as the doctor or the covered entity. You can do it in a PowerPoint presentation. You can send all your staff to a weekend seminar, or you can do the training yourself. The government doesn't state they don't prescribe a particular method of training, just saying that training has to take place. When is the training provided? You establish that. HIPAA doesn't require training on a regular basis. The HIPAA guidelines only require that training be done once. And it was a best practice would be to train new employees within 2 weeks of their start date. Also, HIPAA states that you only have to retrain personnel when there has been a significant change in the HIPAA law. Then you want to establish a monitoring and auditing process. And this is your checks and balances to determine that the things that are happening in the office, the processes, are happening the way that they're stated in your manual, that your policies and procedures are being adhered to. First thing you want to do is describe the process for your auditing, determine who does the auditing, how often is the auditing performed, and who is the person responsible for correcting any identified problems or breaches in the process. Now, this is very flexible. The Office of Inspector General is very non-prescriptive on this because they realize that depending on the size of the covered entity and the resources available, different entities would have a different process or different auditing process. For example, an Emory University would certainly have a much more elaborate process than, say, a one doctor, one staff person private practice. So there is no hard and fast rule on this. Just the rule is that you must monitor and audit your processes, have a defined process, and determine when it's done, how it's done, and who's responsible for it. Then you want to develop or define your response to violations or corrective actions. In other words, if there is a breach in the process, or if there's an error in your process, you want to be able to define what the process is for correcting the error. And you're going to always want to be able to designate the responsible authority for mitigating the error. And that authority may change depending on what the breach or violation is. You want to create a violations or a tracking log. This gives you a method for keeping up with who has been involved in this mitigation process, what their activity was, how long they were involved, because you may bring in different people as a compliance officer. You may want to interview different people at different times about this breach. You want to determine if it was a breach, okay, or a violation. Because many times what people will perceive as a quote-unquote HIPAA violation doesn't meet the standards for a HIPAA violation, but in their mind they think it's a HIPAA violation. So you definitely want to define in your process manual what is a HIPAA violation by the government standards, and then when a potential violation or breach occurs, you can look at the standard guidelines for what the process is, and if it doesn't meet the standards for a breach, then you don't have anything to mitigate at that point. But you also want to state in your process manual, how are you going to close the loop at the end to prevent future violations from reoccurring. Then you want to make sure that you have open lines of communication. Okay. You want to emphasize to your personnel that you have a desire for communication. You don't want the personnel ever to feel like they can't come to you and bring problems to you. Then you want to have a detailed process for how concerns are to be reported, who reports to who, what the process is for reporting, and also ensure employees that they will be protected from any repercussions because they bring problems to your attention. You should want all your personnel, your employees, to bring problems to your attention and not try to hide them from you or cover them up. But they need to understand that even if the problem is being caused by you, they don't have to worry about being fired or being punished because they brought to your attention that you were doing something in violation. And you want to have an open policy that you will listen to their concerns. Sometimes it's not a matter of a violation or a corrective action. It's just that they need you to listen to them about how things are running in the practice and any ideas that they may have that would improve the efficiency of the practice. So you want to make sure that employees always understand there are open lines of communication and you are receptive to their positive feedback. Then you want to have a set disciplinary standards and guidelines. And understand that the disciplinary standards have to be equal for all people. You want to have an established disciplinary levels. For example, a first offense would carry this discipline. A second offense would carry a different discipline. Okay, and make sure that everyone who works in your office, whether they are paid employees, volunteers, or maybe it's a family member who works in your office, everyone is expected to stick to the established policy and protocols, and everyone will be judged at the same level. Okay. Now, understand this. If you are the person who is violating the guidelines and the standards, you have to be willing to take your own punishment, as it were. Otherwise, you'll never have a harmonious practice. Next, you want to know the rules. You want to keep a current copy of what the current scope of practice guidelines are for your state or for the licenses that you hold. Make sure that you're current on updates to the HIPAA law. Find out from your federal plan providers, Medicare, Medicaid, etc., what their local coverage determinations are for chiropractic and keep a copy of that in your guidelines. Also look at things like workers' comp. If your state has specific personal injury guidelines and what you can and cannot provide, what you can and cannot bill for, make sure you keep a copy of those in your compliance manual as well. And annually you want to go to and download the current OIG work plan for that year. The OIG work plan will tell you the errors and the problems that they have found in the documentation standards, building and coding standards for chiropractic, and it will help you to understand what you need to be doing to make sure that you're not one of those people that are showing up on the radar of the Office of Inspector General. In the event that you are audited or you are involved in a lawsuit, you got to remember that the best defense is a good offense. So you always want to have a clearly well-documented patient record. While that may not prevent you from being sued, it will certainly weigh heavily in your favor in the event that you do face a lawsuit or an audit. Also, documentation should be accurate and it should properly reflect the chiropractic services that were rendered and that the standard of care was followed. You also want to make sure that you are always objective in your assessment of the patient, that the things you write in the patient record is objective. You want to avoid personal commentary and opinions about the patient. You can certainly state a professional opinion, but always make sure that your documentation in the patient record is professional and you're using the standards of care language. Because remember, you may not be the only person to ever read that patient record, and you would not want to have something in a patient record that would reflect negatively on you or your abilities and skills as a professional. An inaccurate or altered documentation can ruin an otherwise good defense. So if you have to alter patient's record, or you realize that there are inaccuracies or things weren't recorded properly in the patient's record, you can go back and make modifications, but make sure that you initial and date the modifications and you explain in full detail why that record was altered after its original date of creation. So in closing, just remember to follow all the standards of documentation, cross your T's, dot your I's, be professional, and make sure that all your activities as a professional is above board and within the standards and guidelines of your scope of practice. This concludes our discussion on having a compliant practice.